In spite of the lockdown and many more people vaccinated, the COVID-19 situation significantly deteriorated in Thailand since the lockdown started on July 12th. In this video I will tell you all you need to know about the current COVID-19 situation in Thailand. Hi guys, how you doing? If you're new to this channel, I'm George Thai and you're on My Thai 24. As many of you know, in Bangkok and surrounding provinces and a few more provinces in the south, there has been a lockdown in place since July 12th. However, the COVID-19 situation has not improved at all since then, but unfortunately deteriorated significantly. In this video I will provide you with all you need to know about the current COVID-19 situation in Thailand, and we will discuss the reason why the numbers increased steeply in spite of the lockdown and in spite of many more people vaccinated. Okay, let's have a look at the content. We will start with the topic increasing COVID-19 case numbers in spite of lockdown. And then we're going to talk about the reasons for the escalating COVID-19 situation in Thailand. After that, we will look at COVID-19 measurements and also restrictions. And then we will talk about the hospital bed shortage, which is pretty severe, particularly in Bangkok and surrounding areas. And then we will have a blog on vaccinations in Thailand. At the end, we'll answer a question which I got very often in comments on social media or under my videos. Is it reasonable to travel to Thailand now, or is it too risky? COVID-19 case numbers and statistics. On this graph you can see the development of the COVID-19 case numbers in Thailand since the start of the pandemic. You clearly see the start of the third wave in March, April this year, and then the start of the fourth wave before the third wave went really significantly down. Since mid-June, or actually even much more since end of June 2021, the COVID-19 numbers increased very steeply and the situation further escalated. Now let's compare numbers at the beginning of the lockdown and after 1 month of lockdown. At the beginning of the lockdown, the daily case number was 8,656. This was on July 12th. And after that, the numbers went steeply up and reached 21,038. So they have more than doubled. Now let's have a look at the top 10 ranking of the provinces with highest COVID-19 case numbers per day. At the start of the lockdown, the daily case number was 2,399 in Bangkok, and after 1 month they have almost doubled in spite of lockdown and lots of people vaccinated in Bangkok. In many other provinces, the case numbers have more than doubled. For example, in Samut Prakan and Samut Sakhon, both belonging to the Bangkok metropolitan area, so they are in the surroundings of Bangkok. And even more extreme in Chonburi, where Pattaya is located. There the cases have more than tripled since the start of the lockdown. Now let's have a look at the COVID zoning map in 5 different colors. Dark red for the provinces with the highest case numbers. The dark red zones are also called maximum and strict controlled areas. First, let's have a look at the map of July 12th and July 20th and compare them with each other. See that there are 3 more dark red provinces on July 20th. One of them, Chonburi, where Pattaya is located. And the number of red zones went up from 24 to 53, so 19 more. Overall, you can see the map got much more reddish. And now let's compare the map of July 20th with the map of August 3rd. You clearly see much more dark red provinces on the map. They more than doubled within 2 weeks, from 13 to 29. All of them have strict COVID-19 measurements now and thus are effectively placed on the lockdown. From these infographics charts you clearly see that COVID-19 has enormously further escalated in spite of the lockdown and also in spite of more than 20 million people being vaccinated in Thailand. Reasons for the escalating COVID-19 situation in Thailand. There are various reasons for this further escalation. One of them is that lockdown measurements came really late, are not effective enough and are not effectively enough enforced too, particularly at the beginning of the lockdown. Particularly the first 1 or 2 weeks, quite a lot of people went to crowded places, still went to crowded places, and did not really pay attention or at least not that much attention to social distancing, even at mass vaccination events like this at the mall Nam Wong 1 in Bangkok metropolitan area in mid-July, so after the start of the lockdown, organized by people who should know the COVID disease control rules well. Social distancing rules are not complied with. At this mass vaccination event, they plan to vaccinate 4,000 people in the morning and another 5,000 people in the afternoon. And finally, such a mass COVID-19 vaccine event could turn into a COVID-19 mass spreader event. You can really feel sorry for the people who go there to get protected against COVID-19, but finally risk getting COVID there instead. If even people who should know the rules well do not comply with them, it is not surprising that the average Joe does not comply with them either. I'm talking particularly about the social distancing. Furthermore, due to not strictly enforced travel restrictions, lots of people still could travel from provinces with high COVID case numbers to other provinces, and this spread the disease in other parts of Thailand where the numbers were still quite low in mid-July, which also contributed to the steep increase of COVID-19 numbers nationwide in Thailand. Another problem is that at least the Chinese vaccination Sinovac, which is still mostly used in Thailand, has a low efficacy, particularly also against the Delta variant. People get infected and also sick and even further spread COVID-19 in spite of being fully vaccinated with Sinovac. Moreover, most people just got their first dose, and people who got the Astra vaccine have to wait for about 3 months to get the second dose. And 1 dose of AstraZeneca has also a low efficacy, particularly against the Delta variant, which is more and more prevalent in Thailand. Another reason for the increase in numbers since the lockdown is also that more COVID-19 testing is done, also because more and more anti-gene rapid tests for home use are available. Point number 3, COVID-19 measurements. Due to the further escalation of COVID-19 in Thailand, a state of emergency was extended for another 2 months until end of September. According to a government spokesperson, the extension was necessary to facilitate the swift implementation of measures to control COVID-19 for public safety. As indicated before, lockdown measures are in place in 29 provinces. The Thai government has extended the lockdown measurements for all these 29 provinces from August 3rd for another 2 weeks, but quite likely will further extend the lockdown until the end of the month. For Bangkok, the decision has already been made, and it is planned that the lockdown measures will be in place till end of August. With regard of lockdown measures, you see in this infographic summary of some of the most important ones, starting with work from home. For public transportation like buses and SkyTrain, etc., only 50% of passenger capacity is allowed. Restaurants only delivery service. Department stores are closed with a few exceptions like supermarkets. Convenience stores are only allowed to open from 4 a.m. until 8 p.m. and further restrictions for hotels and group activities. For more details with regard of lockdown measures, please check my video about the lockdown starting on July 12th. I'll leave a link in the description. Now let's have a look at some further important measures and consequences of the measures, which quite likely are interesting for many people, particularly if you plan to travel around Thailand. Let's start with the transportation industry. AirAsia Thailand has already stopped offering any domestic flights since the beginning of the lockdown in Bangkok. At the beginning August, they have extended the suspension of all domestic flights until end of August due to the COVID-19 travel restrictions and record high new COVID-19 cases. They also cut the pay packages for their employees. Bangkok Airways has suspended its flights from Bangkok to Koh Samui except sealed flights in the frame of the Samui Plus sandbox. All flights from Koh Samui to Phuket have been suspended too. Nok Air does not offer flights from and to Bangkok, but they still have flights to Utapao Airport in Rayong. Now let's look at bus travel, and the state-owned Bokosor transport company has announced a temporary suspension of all northern, northeastern, eastern and southern bus routes effective from 3rd August until further notice. With regard of disease control, the government is recommending to wear 2 masks when being in public, particularly in areas with many people. But this is only a recommendation, it's not compulsory. Moreover, they even recommend to wear masks at home, as they have realized that most COVID-19 transmissions happen at home. By the way, as already mentioned in a few of my previous videos, there is a fine of up to 20,000 baht for not complying with the mask wearing rules in public. Point 4. Hospital bed shortage. I've already reported on the hospital bed shortage in Bangkok in my first video about the COVID-19 situation in Thailand in May 2021. I'll leave a link in the description. Those days the COVID-19 numbers per day were less than 2,000 per day, and since then they have increased 10 times. Thus the hospital shortage problem further escalated significantly. Many more hospitals are full and do not accept any COVID-19 patients. Now even more people searching desperately for hospital beds on social media. People often have to wait a long time until they get a hospital bed. If someone is seriously sick, valuable time gets lost by waiting. In more and more cases it takes too long until the ill person is picked up. People are dying at home, or in some cases even on the streets. Many people go to the hospitals by themselves and wait desperately in front of the hospital. End of July, Mr. Somsak Akasip, the Health Ministry's Director General of the Department of Medical Services, frankly said in a press conference that they do not have enough hospital beds. In big hospitals, all intensive care units, ICUs, are overoccupied. Thailand has built a COVID-19 hospital at Bangkok airport amid surge in cases. Thai volunteers turned a cargo warehouse at Bangkok's Don Mueang airport into a 1,800-bed field hospital for COVID-19 patients. Hospitals in Bangkok have the capacity to manage 1,000 new patients a day, but Mr. Somsak said they were well past this number, with 4,000 or even more than 4,000 new cases per day in Bangkok. But Mr. Somsak added that no matter how much we increase the capacities, it's not likely to be enough for this current outbreak. So really very worrisome situation at the moment, particularly in Bangkok and surroundings. But due to increasing cases in many other provinces, Thailand, our hospital beds are filling up in many provinces too. Vaccinations. With regard to vaccination, 20.67 million people are vaccinated in Thailand with at least one dose. And 4.46 million of them already have their second dose, and 221,565 have already got their third dose, as you can see on this infographic. You may wonder, why 3 doses? The reason for this is that more and more fully vaccinated people who get 2 doses, as initially determined to be enough to be fully vaccinated, got infected with COVID-19 and got even ill. Therefore, they started to administer a third dose, particularly to health workers, in order to try to achieve a better protection against COVID-19. Due to the low efficacy of the Sinovac vaccination, they even started mix-matching 2 completely different vaccine types, namely Sinovac, an inactivated virus vaccine, and AstraZeneca, a viral vector vaccine. They started injecting AstraZeneca as a second dose to people who already had 1 dose of Sinovac, and as a third dose to people who already had 2 doses of Sinovac, in a desperate try to make the vaccine more effective, particularly also against the in Thailand more and more prevalent Delta variant. They are doing this in spite of warnings of the WHO chief scientist Dr. Soumya Swaminathan. She had highlighted the danger of mixing vaccines, as very little testing and observation on the practice exists, yet resulting in almost no data on the subject so far. On the other hand, the COVID-19 situation is really very serious now in Thailand, and they do not have any other more effective vaccines available now, and thus they start mix-matching these vaccines anyway. In this infographic you can see at the right bottom corner what and how many of each vaccine have been administered in Thailand until August 5th. You can see the Sinovac vaccine has been mostly used, and the AstraZeneca is second, but most of them only first dose. Third most common is the other Chinese vaccine Sinopharm, and then J&J and BioNTech Pfizer. At the moment, there are still only a few BioNTech Pfizer vaccines available, but this will change in the 4th quarter of this year. Is it okay and reasonable to travel to Thailand now, or is it too risky? Many people ask me these questions either in the comments of my videos on the social media, I would say at the moment the situation has escalated a lot, and due to many lockdowns in place in Thailand, strict travel restrictions, and also due to the hospital bed shortage, I would not recommend to come to Thailand now for a holiday, particularly if you plan to travel around in Thailand or want to come here because of the nightlife and social contacting. It just does not exist, nightlife, and people completely avoid meeting even friends or relatives or family. For sure they don't meet strangers, most of them. I would say to better wait until the case numbers go significantly down. There are no lockdowns and strict travel restrictions in place anymore. If you ask me when this will happen, I assume that the situation will ease a bit in September and October, but quite likely will take until next year for the situation to really normalize. But even this cannot be promised by anyone, as the situation is just quite uncertain like everywhere in the world with this COVID-19 crisis. The uncertainty is unfortunately really high in Thailand. By the way, many countries like US, Germany warn their citizens not to travel to Thailand now. Okay, this was my update about the current COVID-19 situation in Thailand. Actually, I wanted to talk about one more point, namely first-hand COVID-19 experiences of people I closely know in Bangkok, just in order to illustrate the situation here a little bit better. But as this point would have gotten a little bit too long, I decided to make a whole video out of this. I will upload this soon too. If you have any questions or would like to add anything, please let me know in the comment section. If this video was valuable for you, please hit the like button. Thank you. As indicated before, I will have a whole video about first-hand COVID-19 experiences of people I know here in Bangkok. Moreover, I will have many more awesome videos about Thailand soon, so please subscribe my channel and make sure you don't miss them. Thank you very much for watching, and I'll catch you on the next one. Bye!